going to do virtual knee surgery.
Welcome to virtual knee surgery. This activity will show you the process of replacing a failing knee joint.
Awesome.
Are you ready?
Oh, I'm
Today,
so ready.
our patient is a 76-year-old man. It is mandatory to check the patient's vital signs before beginning surgery. An anesthesiologist in the operating room performs this step. If the patient's vital signs are not in the normal ranges, we will not proceed with the surgery. Using the healthy person's vital sign chart as a reference, can our patient undergo surgery today?
What do you think?
Duh.
It looks like
Sounds like a
surgery
man.
will proceed as planned. Take a moment to look at our patient's x-rays. Which knee do you think needs surgery?
Which knee do you think? The right knee or the left knee? What do you think? I think the left
You're right.
knee.
His left knee appears worn down and lacking cartilage,
Oh, yeah.
which is likely the cause of his pain.
Ouch.
The nurse has begun prepping our patient for surgery by placing an IV needle in his right hand.
Ow!
Now it's your turn. Use the marker and write your initials on the proper knee to be operated on. This may
Yellow
seem
thing.
silly, but it's an actual step taken to prevent wrong site surgeries.
Can you see it?
Yeah.
The anesthesiologist administers drugs through the IV and through a mask over the patient's face.
Drugs.
What function should these drugs perform? No.
Oops.
Next one.
Good work.
That one.
Nope.
You're bad.
Great.
You think?
Fantastic.
You're never gonna be an
That's like-
The
anesthesiologist.
patient is unconscious,
Doesn't that look wrong?
and before the first incision is made, we need to establish a sterile field around the surgical area.
AKA.
A series of sterile
Putting a
drapes
sheet on.
isolates the surgical field from the rest of the patient's body. A tourniquet is applied to cut off blood flow, which allows a clearer view of the surgical field during surgery.
Oh, yeah.
To kill
Cut
the
off that
bacteria
blood.
on the patient's leg, clean it in a betadine solution. This scrubbing process will limit the chance of bacterial infection.
Sponge. Scrub into the leg. Oh, he's getting a nice tan.
Oh yeah.
Betadine scrub is applied 2 more times, followed by the final
I don't
arrangement
get it.
of sterile drapes.
Look at that.
Why do you think knee surgery involves so many drapes?
To protect the patient's something.
Good work.
Oh, yeah. And,
Use the sterile marker to draw the location for our incision. And don't forget to mark the perpendicular lines too.
look at that. It's a
Typically,
sterile
the
marker.
incision line is 6 to 7 inches long.
Steph's gonna be a surgeon one day.
People would never let me around those sharp objects.
What purpose do you think the perpendicular lines
To
serve?
make it easier to match up the skin when closing the
Outstanding.
incision.
Now for the incision. Take the scalpel and cut the skin following your markings.
Oh, yeah. Slice that knee.
Let's use the Bovie pencil to cauterize the veins. This will help decrease blood flow into the surgical field.
Well, the Bovie, where the heck's that? See, look, now I'm killing the blood veins. Look at that, I'm burning them up.
The rake retractors fold the skin and tissue out of the way, exposing our patient's knee.
Ew.
To
Hence the
operate,
knee.
we need the patient's knee elevated
Ah!
and bent so the bones are fully exposed. Now the leg is at the proper angle. Use the rongeur to remove the anterior cruciate ligament, or ACL, the meniscus, and any bone spurs that may be lurking about.
I don't know where I'm clicking, you know? Kinda,
Are you a good sculptor?
I
It's
guess.
time to shape the femur, tibia, and patella so the new knee components fit properly. A hole must be drilled inside the femur
Oh, are
to
you
set up
serious?
the distal
Yeah.
femoral cutting
It's
jig
really nasty.
and alignment device.
Oh.
Look at
The
that.
jig is put into position and helps ensure that the
The
cuts
jig.
made to the bone
Oh.
are exactly what are needed. Now hammer in the pins to hold the jig.
The mallet.
We can now remove the alignment device. The pins will hold the jig firmly in place. Now for some real bone shaping. Use the bone saw to cut the bone so it is prepared for the new femoral component.
Are you serious?
Another cutting jig, along with the bone saw, allows us to finish shaping the femur.
Oh my gosh, the poor person.
We're like sawing up his knee.
Let's move on and shape the tibia.
Awesome.
The tibial cutting jig is aligned with the big toe and the highest point of the tibia. This will ensure the leg is properly aligned after surgery. Secure the jig in place with more pins.
The mallet. It's fun
Use the
hammering
bone
people's
saw to cut
bones
off the top of the tibia and prepare it for the new tibial components.
and sawing their bones.
Oh my gosh, I swear this like...
Now we'll use the patellar cutting jig and bone saw to remove the back of our patient's patella.
Why? Oh god, this isn't real.
Holes in the tibia and patella are drilled and chiseled out, which will enable the new components to attach properly. Time to place the trial components. First, attach the
does look like
femoral trial
sculpting.
component.
I know, right? I'm so good. Wait, what do I have to do? Oh, I have to get that.
Attach the metal tray trial component to the tibia.
Wait, that's the... Oh.
The trial.
That took me a while.
Insert the plastic trial spacer into the metal tray component.
That would set off a metal detector.
Lastly, attach the patellar trial component.
Where's the... What the heck am I doing? Oh, that thing.
The patellar.
Why do you think the two tibial components are inserted separately instead of as one unit?
I think that one.
They're
Fantastic. Conduct a range of motion tests
Ready?
to
I
assure
guess I like
proper knee
jerking leg.
alignment and successful success. Typically, a normal range of motion allows the leg to move from 0 to 130 degrees.
Oh, yeah,
How
it's
does our
so
patient's range of motion look?
It looks
Knees
awesome.
aren't meant to bend sideways.
Aww.
So it's important to determine whether there is a
Wish they
gap or space between the femoral and tibial components. There's no noticeable gap, so this knee is a good fit. Why do you think there are so many steps taken to ensure proper alignment?
I don't know.
Great.
Sure.
You're a
Why
good
not?
guesser.
We've tested the trial components.
What,
Now
did you
let's
take 'em
remove
out?
them and prepare for the permanent
You have to
components
cement
by
them.
applying a special cement
Oh.
compound that binds metal and plastic to bone. The scrub technician has mixed up a batch of cement for you to use.
Cement and leg.
With the cement in place, the final components are permanently attached to the knee. Any excess cement will be scraped off and thrown away. Lay the leg
I want
flat
it.
on the table so the new knee components put pressure on each other.
No,
This allows the bone
You're
and
not laying
components to
flat.
bond with the cement. The cement can take anywhere from 10 to 15 minutes to harden. We perform our range of motion tests one final time.
No. Okay.
Our patient's new knee is looking good. Let's close up the incision. First, suture the deep tissue and fat layers back together.
Ew.
For closing the surface incision, you have a choice between the stapler and the suture.
Should I do the stapler or should I
Yeah.
do... Which one?
Stapler.
Oh, yeah. Get that.
What is the primary difference between these two methods of closing the incision?
See, put that out there for
Nope.
security. I don't know.
Nope.
Who cares?
No.
You
Excellent.
got it?
It's
Well,
right
You
there.
know,
My sister
we
put
couldn't
out her
ask for a better participant. You've
Oh,
done
we
an
were good
excellent job.
participants.
Are you sure this is your first total knee replacement? Our patient will
Or
remain
is
in the
it?
hospital for 3 days, followed by 3 to 8 weeks of physical therapy.
Feel
Because
better.
of this surgery, our patient will have significantly reduced pain and
Yay!
increased mobility. Before you leave, let's think about the life of the new knee components.
Do we have to?
What kind of forces do you think the new knee will need to withstand? Nice job. People average about 5,000 steps per day. Our patient's
That's
new
a lot.
prosthetics will withstand a great deal of force for 36 million steps or more.
Oh my
I'm off
gosh.
to check on another patient while the OR team prepares the room for the next surgery. You've been a great help. See you next time.
You sure will. He's still talking.
Who are you talking to? I'm still here. Where's my next patient?
Like, we're doing surgery. Yeah. Okay, ready? We're done.